Greetings, comrades. The South African President, Cyril Ramaphosa, signed into law the National Health Insurance (NHI). Questions have been asked on what this means, particularly to those of migrant community. I was having a discussion earlier on with my South African comrade. They have medical aid. She seemed very unhappy about the decision taken by President Cyril Ramaphosa to sign this into law. We are told again that some opposition parties, particularly the Democratic Alliance and other civil society organizations, will be going to court to challenge the signing of the National Health Insurance (NHI) into law. The Department of Health has produced a questionnaire or responding to questions. The title is Understanding the National Health Insurance. So the flyer that they are distributing deals with what they say frequently asked questions so that people have a better understanding. When I was having this discussion with my South African comrade on this, who was totally opposed to it, I realized the gaps in her arguments, that she does not really understanding what this means. So I hope that comrades like her and others will be assisted by the flyer that the Department of Health is circulating. And I was saying to her that this is also the duty of the Young Communist League of South Africa to assist communities to understand, to educate people about what this national health insurance means. So the first question says, what is the NHI and how will it change the system? The first point raised in this flyer says the NHI is a fund paid by our taxes from which the government will buy health care services for all of us who live in the country, from healthcare providers in the public sector and the private sector. This means when you feel unwell, you can go to your nearest general practitioner or clinic of your choice that has a contract with NHI and not worry about the cost of care. So the argument that my comrade was raising, because she lives somewhere in Soweto, she was saying, look, people in Soweto are saying they are celebrating now, they will be going to Sandton to access the health care. But we will deal with those issues as we discuss this flyer, which has been produced by the Department of Health. And then the second question, which the Department of Health is clarifying, says, why do we need national health care, national insurance? Why do we need national health insurance, NHI? What are the benefits of NHI? One, providing health care for all. South Africa is a member of the United Nations community, and we have committed that we will implement universal health coverage for all. We believe access to health care is a fundamental right for all. The government has the legislative mandate to realize this right, and the government has the responsibility to implement universal health coverage to ensure that all people are able to access the health care when and where they need it without suffering financial hardship. Two, improving quality of services. The public sector has constrained budgets that are not sufficient to provide healthcare services for the 84% of the population that relies on public sector for health care. This results in an overburdened public sector that is characterized by underdeserving. The private sector that serves 14% of the population is characterized by rising costs of care and over-servicing without demonstrating much improvement on health outcomes. Both sectors need a reform to ensure that quality of health is improved. The pooling of funds into one fund will improve quality of services and therefore improve health outcomes. 3. Reducing burden of diseases. Extending health coverage for all South Africans will improve access to care, quality of care, and the continuity of care. NHI reforms will contribute to the health system having a coordinated and a well-structured response to burden of diseases. 5. Financial risk protection. The NHI fund will protect individuals from financial hardships when they need to access the healthcare services. Financial hardships take place when you need to pay out-of-pocket payments such as user fees at facilities and the co-payments for individuals insured by medical schemes. Contribution to the fund will be through prepayment methods such as taxes, and then services will be paid for by the fund and the patient will not have to pay at the point of care. 5. Economic development and growth. A healthy population can work more effectively and efficiently and contributes to economic growth. A productive workforce contributes to the economy through growth of local business, attracting foreign investors and growing the domestic economy. An investment in health is an important safety net against poverty by providing financial protection for everyone. 6. Integration of the health system. The fragmented two-tier system undermines principles of equity and social solidarity and leads to a healthy system where resources are distributed unfairly. The NHI will promote equitable access to care, and this will be achieved by cross-subsidization among the population. The NHI fosters social cohesion and contributes to developing a society that is compassionate across all socio-economic groups. Then what is the significance of passing the bill? 1. Government considers the passing of the NHI Bill by the National Assembly as a key milestone to ensuring all people in South Africa have access to a clinic, a doctor, or a hospital that is private or public or private in brackets, closer to where they live or work without paying when they need the services. We will have paid in taxes already, so the government will pay the provider of your care for you and your loved ones. There will be no gap cover for you to fund and no cash out-of-pocket payments. 2. Government recognizes the efforts by all stakeholders which exercised their constitutional rights to participate in legislative processes to influence decision-making process of the NHI Bill. 3. The department will remain available and accessible at all times to clarify any ambiguities and the public concerns about the bill and its objectives. Final question for the purposes of this video. This is part 1 video. It says, who will be covered under the NHI fund? 1. The fund will purchase services on behalf of South African citizens, permanent residents, refugees, inmates, and specific categories of foreign nationals. Asylum seekers and illegal foreigners will be covered for notifiable conditions and emergency medical services. All children will be covered for all benefits purchased by the fund regardless of nationality. Visiting foreign nationals will be covered by their mandatory travel insurance. We will continue in the next video, but just to repeat the last one, who will be covered under the NHI fund. 1. The fund will purchase services on behalf of South African citizens, permanent residents, refugees, inmates, and specific categories of foreign nationals. 2. Asylum seekers and illegal foreigners will be covered for notable conditions and emergency medical services. 3. All children will be covered for all benefits purchased by the fund, regardless of nationality. 4. Visiting foreign nationals will be covered by their mandatory travel insurance. Please air your views as we continue discussing in the next video. Write in the comment section, like this video, subscribe to this YouTube channel. If you're on TikTok, please follow us. Otherwise, Amandla Comrade.